The emergency department at Sacred Heart Medical Center is one of the busiest in the state and has been since the hospital opened its campus at Riverbend in 2008.
Between our two emergency departments, we start off with about 70,000, and the first year then 75,000. This year we're approaching 80,000.
With the expansion of a number of Sacred Heart's programs, including stroke, cardiology, and trauma, referrals are also increasing.
We really have availability for almost any specialty there is. The only thing that we don't take care of in this emergency department is serious burns that require a burn center in Portland, and then pediatric ICU admissions. We transfer pediatric ICU admissions to Portland. Other than that, we essentially have all service lines available.
A dedicated patient placement line has helped streamline the patient referral process.
The goal is that we want to make it easy for somebody to call up, say, have someone to transfer, and make it a one-call, painless process.
We'll call you back shortly with the room.
Located just off Interstate 5 in the gateway area of Springfield, the ED at the Riverbend campus is easily accessible via ground ambulance and air transport. Inside the ED, 45 private single-patient rooms enhance patient privacy and infection control.
The emergency department that is built for the next 50 years, so to speak, has to have enough beds as more and more patients come, and having more beds has helped us, I think, to be more efficient and to provide better care for more patients.
In addition, there's a special decontamination room with a dedicated entrance and 2 large trauma suites. Sacred Heart has a long history of serving as the Level 2 Trauma Center for much of western and southern Oregon, which means it's capable of caring for severely injured adult and pediatric patients with complex trauma. From the moment a trauma is called, a team of medical professionals is preparing for the patient.
We have every major specialty that you would need to take care of somebody, from neurosurgery, oromaxillofacial, cardiothoracic, pulmonary critical care, general surgeons and gastroenterologists, and orthopedic and plastic surgery and hand surgery. Really, if you can break it, we can fix it.
Throughout their stay, trauma patients are cared for by a dedicated trauma team.
The daily rounds are done by the trauma physicians, trauma surgeons that are taking care of the patient, as well as our trauma coordinator. Then once a week we get together as a multidisciplinary group where we sit down and we discuss all the trauma patients that have come in during the week and what issues they have. We have people from social work, physical therapy, some of our rehab physicians and doctors come, and we get to talk about where the patients are, where they're going, and really try and work on setting up a plan to make sure that they have the nutrition that they need, the activity that they need, and they have really somewhere to go as they keep getting better.
Another key priority at Sacred Heart is the Cath Alert program, which began through a partnership with EMS in 2006 and has greatly reduced the hospital's door-to-balloon time for heart attack patients.
These patients, every 15 minutes of delay, can have up to a 1% mortality increase in the initial phases of the heart attack. So the sooner that we can get these patients taken care of, get their arteries back open, the better they'll do. So a group of multidisciplinary clinicians from the emergency room, including EMS, have all worked to decrease what we call the door-to-balloon time. At the Oregon Heart and Vascular Institute, we call that our Cath Alert system. With that, we've been able to substantially reduce the door-to-balloon time that we've had, and very gratifyingly, we've seen a significant reduction in the mortality.
The American College of Cardiology practice guidelines recommend a goal of 90 minutes or less from the patient's arrival in ED to balloon inflation for angioplasty procedures. At the end of 2011, Sacred Heart's average door-to-balloon time was below 55 minutes, down from 65 minutes in 2009. With immediate availability 24 hours a day of surgeons, anesthesiologists, neurosurgeons, and other physician specialists, Sacred Heart Medical Center at Riverbend provides an increasing level of care to patients in its regional area.
Everything went real well.